Welcome to a new video where we delve into health topics that matter. Today we unravel the mystery of gonorrhea. Gonorrhea is a common sexually transmitted disease that often lurks in the shadows of public awareness. This disease, caused by the Neisseria gonorrhoeae bacterium, can affect both men and women, and it's often silent, showing no symptoms until it's too late. Gonorrhea is a significant public health concern, particularly in the United States, where it is the second most common sexually transmitted infection. It's a tricky disease, as it often goes unnoticed due to its subtle or even non-existent symptoms. But make no mistake, it can have serious and long-term health consequences if left untreated. Understanding gonorrhea is the first step towards prevention and treatment, so let's dive deeper into this topic. As we proceed, we'll uncover the causes, symptoms, and treatments for gonorrhea. Stay tuned as we unravel this health mystery one layer at a time. Understanding the causes of gonorrhea is essential to its prevention. Gonorrhea, also known as the clap, is primarily transmitted through sexual contact with an infected person. This includes vaginal, anal, and oral sex. The bacteria that cause gonorrhea, Neisseria gonorrhoeae, thrive in the warm, moist areas of the reproductive tract, including the cervix, uterus, and fallopian tubes in women, and in the urethra in both men and women. However, it's important to note that gonorrhea isn't solely an issue for the reproductive tract. It can also affect the mouth, throat, eyes, and rectum. So, even if you're practicing safe sex by using condoms during intercourse, you can still contract gonorrhea through oral sex if your partner's infected. Now, let's talk about risk factors. Unprotected sex and having multiple sexual partners significantly increase your chances of contracting gonorrhea. The more partners you have, the higher your risk, and if you're not using protection, well, you're essentially rolling the dice with your health. But it's not just adults who need to be concerned about this sexually transmitted infection. Gonorrhea can also be passed from an infected mother to her baby during childbirth. If untreated, this can lead to serious health complications for the newborn, such as blindness. So, as you can see, gonorrhea is a tricky little bacteria that can spread in various ways. It's stealthy, often showing no symptoms, which means you could have it and not even know. That's why it's so important to get regular checkups and tests if you're sexually active, especially if you have multiple partners or are not consistently practicing safe sex. And remember, just because you've had gonorrhea and been treated for it in the past doesn't mean you can't get it again. There's no immunity to this disease. Once treated, you can still contract it again if you're exposed. Now that we know the causes, let's explore the symptoms of gonorrhea. The symptoms of gonorrhea can be subtle, and sometimes they are not apparent at all. This makes it a silent adversary and highlights the importance of regular testing, especially for those who are sexually active with multiple partners. Let's take a closer look at the symptoms, as they can vary between men and women. In men, one of the most common signs is a burning sensation during urination. If you find yourself wincing in discomfort every time you use the bathroom, it's a clear sign that something isn't right. Another symptom that men might notice is an increased frequency in urination. Suddenly finding yourself needing to urinate more often than usual, especially if it's coupled with discomfort, is a red flag that shouldn't be ignored. Perhaps the most telltale symptom in men is a discharge from the penis. This can be a white, yellow, or greenish discharge, and it's a strong indication that you should seek medical attention. In women, the symptoms can be slightly different. Like men, women may experience painful urination, which is often one of the first signs of an issue. Increased vaginal discharge is another common symptom. This might be accompanied by a strong odor, and it's a sign that your body is trying to fight off an infection. Another symptom that is more common in women is bleeding between periods. If you're noticing spotting or bleeding at times when you're not expecting your period, it's important to reach out to a healthcare provider. It's also worth noting that gonorrhea can affect the rectum in both men and women, leading to itching, soreness, bleeding, and even painful bowel movements. These symptoms can be uncomfortable to talk about, but ignoring them can lead to serious complications. Gonorrhea is a treatable condition, but left unchecked, it can cause long-term health problems. Remember, the best protection is prevention, but if you find yourself experiencing any of these symptoms, it's crucial to seek medical attention promptly. Proper diagnosis and treatment are key to managing gonorrhea. So, how does one go about diagnosing this common sexually transmitted infection? Well, it usually involves a simple urine test or a swab of the affected area. This could be the throat, rectum, or genital area. depending on the nature of the sexual contact you've had. The samples are then sent to a laboratory for analysis. It's important to get tested if you believe you have been exposed or if you experience any symptoms, as untreated gonorrhea can lead to serious health complications. Now let's talk about treatment. Once diagnosed, gonorrhea is typically treated with antibiotics. The good news? This medication is usually very effective. Doctors often prescribe a dual therapy, that is, 2 antibiotics taken together. One of these is a single-dose antibiotic injection administered by a healthcare professional, and the other is an oral antibiotic that you'll take for 7 days. You might be thinking, great, I've taken my antibiotics, I'm cured. Not so fast. While antibiotics can kill the bacteria causing the infection, it's crucial to complete the full course of medication. Even if you start feeling better or your symptoms improve, stopping treatment early can enable the bacteria to continue to grow, potentially leading to a return of the infection. Furthermore, it's important to abstain from sexual activity until the infection is completely cleared to prevent spreading it to others. Another key point to remember is that having had gonorrhea once doesn't make you immune to getting it again. In fact, it's quite the contrary. Having been infected can actually increase your susceptibility. This is why regular testing is so important, especially if you have new or multiple sexual partners. One final note on treatment: if your symptoms continue even after treatment, it's crucial to return to your healthcare provider, as this could be a sign of a resistant strain of gonorrhea. While this is rare, it's a serious concern, and it underlines the importance of using protection to prevent the spread of STIs. So there you have it. Diagnosis involves a simple test, and treatment typically includes a course of antibiotics. It's a straightforward process, but it's one that requires your full commitment to ensure full recovery. Remember, while treatment is effective, prevention is always the best cure. Prevention is the most effective method to keep gonorrhea at bay. Let's talk about how you can protect yourself and your partner from this common sexually transmitted infection. First off, one of the simplest and most effective ways to prevent gonorrhea is by using condoms or dental dams during sexual intercourse. These barrier methods block the transmission of bacteria, effectively reducing the risk of infection. Remember, it's important to use them every time from start to finish during any type of sexual contact, be it vaginal, anal, or oral. Next, regular screenings play a crucial role in preventing the spread of gonorrhea. If you're sexually active, especially with multiple partners, it's advisable to get tested regularly. Early detection allows for prompt treatment, preventing complications and the spread of the infection to others. Even if you don't have any symptoms, getting tested is important because many people with gonorrhea don't experience any noticeable signs. Now, let's talk about relationships. Maintaining a mutually monogamous relationship with a partner who's been tested and is free of any sexually transmitted infections is another effective method of prevention. This means both you and your partner agree to only have sexual contact with each other, reducing the risk of exposure to gonorrhea and other STIs. Communication is key in this aspect. It's essential to have open and honest discussions about sexual health with your partner. Talk about your STI statuses, past sexual experiences, and the precautions you both can take to ensure your health. This kind of conversation might feel uncomfortable at first, but it's crucial for the safety and well-being of both parties. Another point to note is that if you've been treated for gonorrhea or any other STI in the past, it doesn't make you immune. You can get infected again, so continued vigilance and adherence to preventive measures is necessary. Lastly, abstaining from sex is the surest way to prevent gonorrhea and other STIs. However, if you choose to be sexually active, adhering to these preventive methods can greatly reduce your risk. In conclusion, prevention of gonorrhea comes down to practicing safe sex, getting regular screenings, maintaining a mutually monogamous relationship, and having open conversations about sexual health. Each of these steps plays a significant role in keeping you and your partner healthy. Remember, your health is in your hands. Stay safe, stay informed. Today we've learned a lot about gonorrhea. We've delved into the nitty-gritty of this sexually transmitted disease, starting from its very definition, all the way to the methods that can prevent its spread. We've understood that gonorrhea is a bacterial infection, primarily transmitted through sexual contact, but can also spread from a mother to her newborn during childbirth. The symptoms, though often subtle, can cause severe complications if left untreated. We've also explored the importance of getting tested if you suspect you have been exposed to the disease. Early diagnosis is key to effective treatment. which typically involves antibiotics. Prevention, as we've learned, is better than cure. Using barrier methods during sexual activities, getting regular checkups, and maintaining open communication with partners about sexual health are all crucial preventative measures. Thank you for joining us in this exploration of gonorrhea. Remember, knowledge is power. Stay informed, stay healthy,